This is our simulation project for fetal demise. I'm Marina and I'm going to be the narrator.
I'm Gabby. I'm going to be the sister.
I'm Kat. I'm going to be the ED nurse.
I'm Chloe. I'm going to be the midwife.
I'm Kate. I'm going to be one of the L&D nurses.
I'm Drew. I'm going to be one of the L&D nurses as well.
I'm Melby. I'm going to be the discharge nurse.
I'm Rachel. I'm going to be the mom.
So our patient, Flora, presented to the emergency room with signs and symptoms.
Hi, I fell down the stairs and I can't feel my baby moving. I don't really know where I am and I have this horrible abdominal pain and it feels like really bad cramping and there's some blood and I'm not really sure where we are.
Okay, we're at Jefferson Hospital. You're in the emergency department. Let's get you to a room so you can sit down and get comfortable, and we'll do some things from there.
Hi, I'm Flora's sister, and I just wanted to let you know that Flora's been smoking and drinking throughout her pregnancy, and I'm pretty sure that's why she fell down the stairs last night, because she was drinking a bottle of wine.
Oh, wow.
And she's also, I'm pretty sure, been using cocaine throughout her whole pregnancy.
Okay, well, I'm going to take her back to the room. I'm going to do some vital signs, palpate her fundus, check the bleeding and see what's going on. I'm also going to get her started on some IV fluids, and we're going to get some blood work and a urine sample, so we'll be able to see the levels of all of your suspicions there.
Great, thank you.
After initial tests, Kat, the ED nurse, decides to admit Flora to the labor and delivery unit. So Kat transfers Flora and gives an S-bar to labor and delivery nurses Drew and Kate.
Hi guys, I am transferring to the OB floor. I have a 36-year-old, 22 weeks, G1P0, admitted 30 minutes ago from triage after a fall down the stairs. She has spotting, severe pain. I'm thinking it's possible placental abruption or fetal demise. She's a nullipara with a BMI of 26. She has a history of hypertension and cigarette smoking, as well as some cocaine use. She's had a previous CVS with positive results for genital abnormalities, and she has family history of kidney disease. Vital signs were taken at the ED. She's been slightly hypertensive. She is bleeding from the vagina and it seems to be more than just spotting. After palpation, her fundus was rigid. So I've run blood tests and urine samples, and I think she needs to have an ultrasound done.
Okay, so we'll be accepting the Ms. Smith, who's having the severe abdominal pain, some bleeding, and we understand your recommendation of a possible ultrasound to rule out placenta abrupto and fetal demise.
So we ran a fetal ultrasound, and it revealed that there was a presence of a placenta abruption. We did a fetal heart monitoring or fetal tracing to reveal that there was a normal contraction, and due to potential fetal distress, a C-section is potentially going to be requested.
So we have the monitor set up. We took our vitals. Let's give our midwife a call. What do you think, Drew?
Sounds good. So I'm calling. So I call up our midwife, and who is Chloe, and I'm calling Chloe due to the presence of a placental abruption and due to hemorrhaging.
So Drew, the labor and delivery nurse, calls the midwife, and they have decided that it is in the patient's best interest for the midwife to get there as soon as possible to take an ultrasound and determine if it is in fact a placental abruption and what the route of delivery is going to be.
Hi guys, thanks for giving me a call. So from what I understand, we have a 36-year-old patient presenting to you guys from the ED with severe abdominal pain. I understand that your nursing diagnosis is possible placental abruption. So thanks for getting, the assessments and vitals. I think I definitely want to do another ultrasound with you guys in the room, and then so I can personally see for myself what's going on. And we can definitely go from there. Flora, how are you feeling today?
I'm having a lot of pain and there's some blood and I have this severe abdominal cramping and I don't really know where I am.
Okay. Just, what we're going to do now for you is we're going to do another ultrasound and see what's going on with you and baby. And I'm sorry you're having this pain, but we are going to try, figure this all out for you. Okay, so I do an ultrasound, and the findings were that she has a placental abruption. And so Kate and Drew, I think definitely going to want to get her to deliver via cesarean section. We need to get her to the OR room as soon as possible.
So the midwife and the L&D nurses assist to the OR where Flora is going to be having a C-section.
Okay, so we deliver the baby via C-section. Upon assessment of the newborn, he is cyanotic, he's not breathing, his APGAR score is 4 out of 10, extremely low. He's just not moving, not breathing, and we need to resuscitate. Kate and Drew, please begin CPR.
Okay, starting CPR.
Why can't I hear my baby? What's going on? What's happening?
Still no pulse, still no breathing.
Continue a couple more minutes before we call it. From the looks of it, the baby is unable to, after performing CPR for a very long amount of time, we are unable to get the newborn to breathe. He has no airway, he's not breathing. Time of death of the fetus is 11:35 a.m., March 25th, 2021. And yeah, unfortunately, the fetus did not make it due to placental abruption.
So now after determining that the fetus didn't make it, nurses bring Flora back to the room to do post-op care, let her know that her baby did not make it, and to give her her discharge plans.
I'm so sorry you lost your baby. I know this is hard for you, but I'm going to refer you to some support groups in your discharge instructions. I'm also going to make sure you're okay and check your vital signs once more, check for bleeding. And if you need anything, please press the call button. And if you experience any excessive bleeding upon discharge, please call your provider. Again, I'm so sorry for your loss.
So that concludes our simulation for fetal demise. Flora presented to the ED with a lot of pain and bleeding. Kat took her to the labor and delivery unit where they ran some more tests and decided that it was in fact a placental abruption. Upon delivery of the baby, they weren't able to revive it, so unfortunately the baby ended up passing. Melby, our discharge nurse, gave her instructions, especially for post-op complications, and Flora goes home, unfortunately, with no baby today. So that wraps up our Group 16 simulation.